What's up, everyone? This is Dr. Charlie Johnson, physical therapist. Appreciate you checking out my channel. Appreciate you checking out this video. If you're new to my channel, I help people all around the world with unresolved back, butt, and sciatic problems by teaching them how to use the power of the mind and movement as medicine. And in this video, you're going to see exactly what I mean as I help an individual who had back surgery about 7 months or so ago start to overcome his fear of sitting, start to overcome his challenge and his inability to tolerate sitting for more than, gosh, just 10, 15, 20 minutes, all right? So you'll be able to see how I start to challenge his beliefs about sitting. I challenge the narrative that he's been told about sitting and how it's, you know, the new smoking and how it's crushing his discs and things like that. And then I also help him use movement and understand how he can begin to increase his tolerance for sitting over time and with practice. So check it out. Let me know your thoughts and leave a comment below.
Sitting is one of my biggest enemies. And like initially, if I sit down, I'm okay. And then for some reason it'll build and build and build. Whereas before surgery, sit instant. Like I could recreate that pain like that. Like if somebody says, can you recreate your pain before your surgery? I lift my leg up, boom. If I sat down, boom.
Yep.
But now, I mean, I'm doing all that, but it's just, I don't know what it is. It's like I'm starting to feel weird sensations all over, and then it gets sore, and I'm like, okay, time to stand up. Something's going on. What happened? And then I could feel my blood pressure go up. I can feel it.
Yeah. So what you're going to get if you're not careful, okay, is you're going to start to get stuff all over the place. Your mid back, your hips, your shoulders, your neck. It's going to start to travel probably. Okay. And it's probably because of that sympathetic response to it. Right. And so what I would say to you is like, what do you do in that moment, man? Meaning, if you're too freaked out, right, sitting is your enemy. You've labeled it already as your enemy. So you're going to war when you sit at this point. All right. And so when you sit down and you're engaging in battle, right, you're fine for the first few shots and then you start to get wounded. Right. And so like, what do you do when you start to notice symptoms come up? You say, it sounds like right now, I've got to run away from the enemy. Retreat.
I don't know if this makes sense at all. When I'm sitting down and it's starting to bother me, my mind gives me mental images of my disc and my back just getting crushed because I'm sitting. So
Fine, but it's not true.
Thank you.
I don't.
So I tell them all the time, I'm like, you can't. We have to sit.
So then
so is it crushing her discs right now?
Exactly. And I've got the same thing. So
I know I shouldn't listen all the time, but I just remember the doctor saying, well, sitting is the worst thing you could do as it is. And I'm like, yeah, but I can't stand all day long. He's like, well, you should really only be sitting for going to the bathroom and eating.
Yeah, but that's not true. I'll just tell you that's not true. Okay, because here's the thing, man. When all the standing desks, there's 2 times in my career I can remember. I'm not that old, so this tells you something. Okay, so number one was when the standing desk came out. I was treating people right with aches and pains that were blamed on sitting, you know, prior, because that's all people did, right? And then when the standing desk came out, then I was just treating people who hurt because they were standing all the time.
Right.
You just traded one thing for another problem.
Yeah, my back kills me if I stand too long. Yeah,
and so then you know, maybe what if I was to say like, hey, standing is actually when you're right. And so I'm not going to do that. But like at the end of the day, and then I was treating people. The second thing was when those yoga ball seats came out and everyone was like, oh, like you got to sit like this. Right. Well, and then like literally I have multiple testimonials of people coming to the program and they just threw away the ball and their back pain went away. Right. And so like the belief though, for years for some of these people that they need to sit like this or they need to move like this because media or someone in the world told them that, actually kept them from getting better because instead of listening to their body and what felt best, right, they I don't know, they didn't, right? And then they just like conformed to it and then they just bought into it. And even though it hurt and even though it didn't feel comfortable, it was like, well, I'm still going to do that thing because that's right or whatever, you know what I mean? And so you have to be willing at some point, nothing against surgeon, but I would say, what can we do to get rid of that? And the only way you could get rid of that is probably to disprove it. I would get that narrative out. That's fine. Picture that crushy disc and then put like some funky smiley face on it, man, with like its tongue sticking out of you.
Okay.
You know what I mean? Like how can you replace that image with something that's, picture it like a s'mores, man, but it's not your disc. Like you want to eat that thing. Like, all right, great. It's almost Thursday, Friday. I'm going to have a fire. I love
So
s'mores.
so me sitting there, it's not crushing
No.
it, right?
Well, dude, your discs are designed to load and respond to load. Okay. Anything where you're not lying down is going to load the disc.
Okay.
Right. So like when you look at disc models, I mean, the least amount of pressure through disc is laying down. Standing is still pretty low, but there's pressure through it. Right. Yes, of course, bending forward and lifting hundreds of pounds would increase it, but carrying any amount of weight is going to increase it more because gravity plus the weight. Right. And so lifting, carrying objects is going to be the heaviest load. But just sitting there, I mean, sitting is not the new smoking, right? That's what people tell you, right? It's just you got to do it, man.
Right.
I don't sit for more than a half an hour as it is. I mean,
I would say, could you sit there longer? Meaning, here's what I'm saying. Okay, that which you run away from in life, you continue to reinforce that is dangerous, right? So sitting is your enemy. Sitting is your enemy. Sitting is your enemy. Every time you retreat, it wins.
Right.
Okay. Now, in all fairness, if symptoms are like 10 out of 10, man, then okay, you're too scared to do that, and that's fine. Okay. Then don't sit. Get out of it. Okay. But if you overuse and you abuse the avoidance strategies, the tweaks, every time I sit, I feel pain, and I'm okay. I got to get up. It reinforces to your brain that, yep, see, that is crushing disc. And so when you start to notice symptoms, rather than running from that enemy, put up a shield. Take some arrows to it, right? Here's some boing, ding, doing, right? Some bullets going off it. But here's the thing, it's got to be tolerable. A 2 out of 10, a 3 out of 10, a 4 out of 10. You probably have a couple minutes or moments where you could maybe do that. And you notice what's happening in my body. Wow, there's that thing. I have this image. What's happening, man? Where are the symptoms? Are they moving around? Is it throbby? Is it sharp? Is it whatever? Take a moment. Okay, it doesn't need to be long. Okay, now, at this point, right, you're picturing this disc being crushed, but Charlie just replaced it with like this ooey gooey s'mores. Maybe you don't like that. So if you don't like that, don't use it. Okay. But like, there's this marshmallow on my back and it just looks so good. Right. And so again, you notice the humor in that, right? But even if you could just do that and like have a little smile and then get up, that would be a good start.
Okay.
So I'm not saying sit there go from 30 minutes to 4 hours. I'm just saying, hey, like you say,
that's crazy, because I remember the doctor, even for all the years, I mean, she's known me. I don't think I've ever been that big of a sitter.
He's got ADD.
Mm-hmm.
You do.
Look, he's gonna whack you, or you're gonna whack her. I don't know what's going on. But that's the idea. Okay, so the idea of performing those techniques, right, and the techniques that you're learning is to kind of reappraise or reprogram, right, your brain and your body to take those sensations, which you just are enemies with right now, and say, hey, we actually like shook hands for a second. That was weird. Okay, now I don't like you, so whatever, and then run away. It's fine. But if you can do that, right, even if it's just like you had a little laugh and that was it, and it took you 20 seconds, right? There's no like, here's the thing, it's a little bit of an art. So there's no like, you can't screw this up. So don't worry, you're going to mess it up. You could totally tomorrow be like, I have no idea what he said. All I remember was ooey gooey s'mores, and that sounds like it's pretty good. And so I'm just going to picture that whenever I start to notice something, and you would still do better than nothing.
Okay.
All right. And so you want to start to confront it a little bit, because if you don't confront it, right, then you're gonna continue to strengthen that link. Sitting enemy, sitting enemy, sitting enemy. And before you know it, it's like, I mean, you're always at war with it.
So it's hard to break, isn't it?
Well, some people can break it quicker than others. Your personality might take a little bit of work.
Yeah.
Okay, that's okay. Don't worry about it. It's all good, man. Here's the thing. You don't have to be that personality.
Right.
Right? If you can have other moments, because here's what I'm saying, it probably spills over. This personality trait probably spills over to maybe to some other things. And so forget about the pain for a moment. How could you show up in life other ways? Maybe when you're interacting with kids, or you're, you know, doing stuff with Carrie, or I don't know, you're cooking dinner or whatever. Are you hyper vigilant about like making sure you don't screw up the recipe all the time? Or it's like, ah, screw it. Salt. Yes. That, right? I don't know.
No, because stuff's too expensive.
See, right? I get it, man. And so it probably serves you in some areas of life, but I would just say like, hey, how can I just like generally kind of try to go through any area of life or anything I'm doing in life, right? You know, with a sense of kind of like lightness versus such intensity.
Mhm.
You know, do you go on a hike through the woods and, you know, you're like, okay, well, what about the ticks? What about the spiders? What about the this? What about that?
It's not funny. No, because I always wanted to go hunting, you know.
Dude,
deer hunting and stuff,
you can come archery hunting with me.
but I was like, no, because I don't want to deal with the deer ticks.
You want to go turkey hunting tomorrow?
Sure.
Cool. So look, don't be too hard on yourself. Okay. Like have some self-compassion and have some patience with this, man. Like it's a bit wired. And so, practice it. Just if you can take even one thing from the call today, you don't have to be overwhelmed by, like you said, lots of stuff. Now I need to go study it and memorize everything. No, you don't. Kara remembers some things too. So if you can't remember it all, she'll be able to help you out, take a couple of things away. But super good chat. All right, so hopefully that coaching call from inside of my private coaching program, that little snippet, was helpful for you if you're fearful of sitting, if you're having trouble getting back to sitting, if you've been told that sitting is a disc crusher and or something that you should not do, and it's the worst thing that you should do to resolve your pain and or problem. So let me know your thoughts below. If you want to better understand how you are in the best position, not the doctors that you want to go see, not somebody else trying to crack your back or fix you, but you, the person in pain, or the best person to get yourself out of pain, and you want to learn a process for resolving your pain, whether it be in your back, your butt, and or any form of chronic sciatica, then go ahead, click the link above. Basically, it takes you to a free workshop where I start to share my process and sort of the logic behind how we can teach you how to solve your problem. Thanks so much, everyone. Appreciate checking out my video. Also, be sure to hit the like button, the bell, as well as the subscribe button. That's all I got. Thanks so much for checking out my channel. And if you'd like, leave some comments below.